മനുഷ്യ ശരീരത്തിന് അകത്തും പുറത്തുമായി സൂക്ഷ്മജീവികളുടെ ഒരു വിശാല ലോകമുണ്ട്. നഗ്നനേത്രങ്ങൾ കൊണ്ട് കാണാനാവില്ലെങ്കിലും ആരോഗ്യത്തിലും രോഗത്തിലും ഇവർ വഹിക്കുന്ന പങ്ക് വളരെ നിർണായകമാണ്. നമസ്കാരം, ഞാൻ ഡോക്ടർ സിദ്ധാർത്ഥ് S.K. ഇന്ന് നമ്മൾ സംസാരിക്കുവാൻ പോകുന്നത് ഹ്യൂമൻ മൈക്രോബയോമിനെ കുറിച്ചാണ്. ആരോഗ്യജാലകത്തിൻ്റെ 2ാം അധ്യായത്തിലേക്ക് എല്ലാ പ്രേക്ഷകർക്കും സ്വാഗതം. നമ്മളോട് ഈ വിഷയത്തെപ്പറ്റി സംസാരിക്കുവാൻ വേണ്ടി ഇന്നിവിടെ എത്തിച്ചേർന്നിരിക്കുന്നത് ഇന്ത്യയിലെ തന്നെ ഏറ്റവും പ്രഗത്ഭനായ ഒരു ഭിഷഗ്വരനാണ്. കേരളത്തിലെ ആദ്യത്തെ ഹെമറ്റോളജി യൂണിറ്റ് രൂപം കൊള്ളുന്നത് ഇദ്ദേഹത്തിൻ്റെ നേതൃത്വത്തിലാണ്. ഇൻ്റർലൂക്കിൻ, ഇൻ്റർഫെറോൺ, എറിത്രോപോയറ്റിൻ, ക്യാൻസർ ചികിത്സാ രംഗത്ത് ഉപയോഗിക്കുന്ന ഇമ്മ്യൂണോ കീമോതെറാപ്പി തുടങ്ങിയ നൂതന ചികിത്സാ രീതികൾ ഇന്ത്യയിൽ തന്നെ ഏറ്റവും ആദ്യം ഉപയോഗിക്കുന്നത് ഇദ്ദേഹമാണ്. 2007 ഹ്യൂമൻ മൈക്രോബയോം പ്രോജക്റ്റ് ആരംഭിക്കുന്നത്. ഈ പ്രോജക്റ്റിനെ ക്ലിനിക്കൽ മെഡിസിനുമായി ബന്ധിപ്പിച്ച് ഏറ്റവും ആദ്യം സംസാരിക്കുന്നത് ഇദ്ദേഹമാണ്. ദേശീയ അന്തർദേശീയ തലങ്ങളിൽ നിരവധി പുരസ്കാരങ്ങൾ ഇദ്ദേഹത്തെ തേടിയെത്തിയിട്ടുണ്ട്. ആരോഗ്യ ഗവേഷണ രംഗത്ത് ഇദ്ദേഹം ഒട്ടനവധി സംഭാവനകൾ നൽകിയിട്ടുണ്ട്. മറ്റാരുമല്ല, ഡോക്ടർ പ്രൊഫസർ കാസിം അബ്ദുൽ സലീം. ഡോക്ടറെ ഈ ചർച്ചയിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. നമസ്കാരം സർ, ചർച്ചയിലേക്ക് സ്വാഗതം. സർ, നമ്മുടെ മനുഷ്യ ശരീരത്തിലെ മുഴുവൻ കോശങ്ങൾക്ക് 10 ഇരട്ടിയാണ് ബാക്ടീരിയകളുടെ എണ്ണം എന്ന് പറയുന്നത് നമ്മുടെ ശരീരത്തിനകത്ത്. ഈ പൊതുവെ പൊതുജനത്തിന് ബാക്ടീരിയ വൈറസ് നോക്കുമ്പോൾ ഒരു ഭയമാണ്. പക്ഷേ എല്ലാ ബാക്ടീരിയ മോശക്കാരല്ല. നമ്മുടെ ശരീരത്തിൽ എല്ലാ ബാക്ടീരിയ എടുത്ത് കളയുകയാണെങ്കിൽ നമ്മൾ നിലനിൽപ്പ് തന്നെ അപകടത്തിലായിരിക്കും. അപ്പോൾ സർ, എന്താണ് എല്ലാ ബാക്ടീരിയകളും മോശക്കാരാണോ? എന്താണ് നമ്മുടെ മനുഷ്യ ശരീരത്തിലെ സൂക്ഷ്മജീവികളെ പറ്റി എന്താണ് സാറിന് പറയാനുള്ളത്?
അതൊരു നല്ല ഒരു ചോദ്യമാണ്. ഇപ്പോൾ നമ്മുടെ എല്ലാം വിചാരം ബാക്ടീരിയ എന്ന് പറഞ്ഞാൽ നമ്മളെ ശത്രുക്കളാണെന്നാണ്. വാസ്തവത്തിൽ ബാക്ടീരിയ നമ്മുടെ മിത്രങ്ങളാണ്. ഇപ്പോൾ നമ്മുടെ ഈ ഭൂമിയിൽ അവർക്കും അവകാശമുണ്ട്, ഈക്വലി ഇമ്പോർട്ടൻ്റ് ആണ്. അപ്പോൾ നമ്മൾ അവരില്ലെങ്കിൽ നമ്മുടെ ഒരു കാര്യവും നടക്കില്ല. യു കനോട്ട് ഈറ്റ് എനി ഫുഡ്. ഇവിടുത്തെ ഒരു ഗ്രീൻ കാണുന്നുണ്ടെങ്കിൽ ബാക്ടീരിയ ഇൻ ദ സോയിൽ, എന്നാലേ സംതിങ് ക്രോപ്പ് വിൽ കം അല്ലേ. ആ ഗ്രീൻ വരുന്നത് എന്ന് വെച്ചാൽ സൂര്യപ്രകാശം ഉള്ളതുകൊണ്ടാണ്. ഇത് കണ്ട് പ്രിപ്പയറിങ് ദി ഫുഡ് ഫോർ അസ് അല്ലേ, കാർബോഹൈഡ്രേറ്റ്. അത് ഫോട്ടോസിന്തസിസ് എങ്ങനെയാണെന്ന് നമുക്കിപ്പോൾ അറിയില്ല. വി ഡോണ്ട് നോ നമ്മളെ ആക്ച്വൽ മെക്കാനിസം. ദെയർ ആർ സോ മെനി തിങ്സ് വി ഡോണ്ട് നോ. നമ്മൾ ഇത്രയും വർഷമായെങ്കിലും ഭാഗ്യവശാൽ നമ്മൾ ഇത്രയും കാലം ജീവിച്ചിരുന്നു. അപ്പോൾ ഞാനൊരു 97 തട്ടിപ്പോന്ന് വിചാരിച്ചാണ്. ഈവൻ ആഫ്റ്റർ മാരേജ് ഐ തോട്ട് ഐ മേ നോട്ട് സർവൈവ് ടു ലോങ്. ഐ വാസ് സോ തിൻ ആൻഡ് ഹംഗ്രി ലുക്കിങ്. അതുപോലെ എനിക്ക് എപ്പോഴും വയറ്റിന് അസുഖം. അപ്പോൾ ഇതൊക്കെ കണ്ടാണ് നമ്മളൊരു ചില കാര്യങ്ങളൊക്കെ പഠിച്ചത്. നമ്മുടെ തന്നെ എക്സ്പീരിയൻസ് ആണ്. സോ ഇറ്റ് ഈസ് സംതിങ് ലൈക്ക് ഒരു എന്താണ് ഒരു ഡോക്ടറുടെ വീഴ്ചകളും പാളിച്ചകളും ഒക്കെ അതിൽ കൂടെയാണ് നമ്മൾ കുറേയൊക്കെ മനസ്സിലാക്കിയത്. പിന്നെ ഒരു ഡോക്ടേഴ്സ് ഫാമിലി എന്ന് പറയുന്നത് എൻ്റെ ഫാദർ ഒരു ഡോക്ടറായിരുന്നു. ഫാദറിൻ്റെ ഫാദർ വൈദ്യരായിരുന്നു. അതിന് മുമ്പ് നമുക്ക് അറിഞ്ഞൂടാ. ഫാദറിനെ ഞാൻ കണ്ടിട്ടില്ല. His father was a bit on the age about 30 കഴിഞ്ഞിട്ടാണെന്ന് തോന്നുന്നു he got married. അപ്പോൾ I was only 3 years when he passed the MBBS from Madras Medical. അന്ന് മദ്രാസ് മെഡിക്കലേ ഉള്ളൂ. അങ്ങനെയാണ് നമ്മുടെ ഒരു ഓർമ്മ വരുന്ന ഒരു about 3 years ഒരു ഫോട്ടോ ഉണ്ട് എൻ്റെ. 3 year old. എൻ്റെ ഫാദറും എൻ്റെ ചേട്ടൻ ഒരു 6 years എന്നെക്കാളും 6 years അഡ്വാൻസിനാണ് ചേട്ടൻ. അപ്പോൾ അത് കഴിഞ്ഞിട്ട് നമ്മളുണ്ടായി. അപ്പം അങ്ങനെയൊക്കെ ഒരു സിറ്റുവേഷൻ ഉണ്ട്. അത് നമ്മുടെ ആദ്യത്തെ ഒരു എപ്പിസോഡിൽ നമ്മൾ പറഞ്ഞു നമ്മുടെ സ്ഥിതിയൊക്കെ. അപ്പോൾ ഇങ്ങനെ അത് വന്നിട്ട് നമ്മൾക്കൊരു ഡോക്ടറുടെ രീതിയിൽ പോകണമെന്നൊരാഗ്രഹം കൊച്ചിലെ തന്നെയുണ്ട്. അപ്പോൾ കൂടുതലും നമ്മൾ സമയം കൂടുതലും ഫാദറിൻ്റെ കൂടെ സ്പെൻഡ് ചെയ്യും. ഹോസ്പിറ്റലിൽ പോകും. സ്കൂൾ കഴിഞ്ഞാൽ ഹോസ്പിറ്റലിൽ പോയിട്ട് അവിടെ ഫ്രീഡം മുറിയിൽ പോയി നിൽക്കും. പേഷ്യൻസ് ഇങ്ങനെ വരും, അവരെ കാണാൻ സംസാരിക്കുക, അങ്ങനെ ഓരോ കാര്യങ്ങൾ ചോദിക്കുക, അങ്ങനെയുള്ള തമാശകളും. ഒരു അഡ്വക്കേറ്റ് ഉണ്ട് എൻ്റെ ഫ്രണ്ടായിട്ട്, അദ്ദേഹം വൈകിട്ട് അവിടെ വരും. സോ വേർ ഒരു ടൈം സ്പെൻഡ് ചെയ്യുന്ന അവിടെ ഒരു റൂമിൽ കുറേ കാര്യങ്ങൾ പറയും. അപ്പോൾ അങ്ങനെ അതിൽ പെട്ടിട്ട് നമ്മൾ കുറേ കാര്യങ്ങളൊക്കെ മനസ്സിലാക്കുകയും അങ്ങനെ പല എക്സ്പീരിയൻസ് അതിൽ നിന്ന് കിട്ടുകയും ചെയ്തിട്ടുണ്ട്. അപ്പോൾ ഇപ്പോൾ മൈക്രോബയോം എന്ന് പറയുന്നത് നമ്മളൊരു ഇൻഫെക്ഷൻ എന്ന് പറയുമ്പോൾ ബോഡി ഇൻഫെക്ഷൻ എന്ന് പറഞ്ഞാൽ എല്ലാം നമ്മൾ ഇൻഫെക്റ്റ് ചെയ്യാൻ വരുന്നതൊന്നുമല്ല ഈ മൈക്രോബയോം. നമ്മുടെ ശരീരത്തിൽ തന്നെ മേജർ പ്രൊപ്പോർഷൻ മൈക്രോബയോമാണ്. ഞങ്ങൾ 57% നമ്മുടെ ശരീരം എന്ന് വെച്ചാൽ സൂക്ഷ്മാണുക്കളാണ്. അത് സൂക്ഷ്മാണുക്കളിൽ ബാക്ടീരിയ ആവാം, ബാസില ആവാം, ഫംഗസ് ആവാം, ആർക്കയാവാം, പിന്നെ ചെറിയ പുഴുക്കളാവാം. ഇവൻ നമ്മുടെ മുഖത്ത് പോകുന്ന സൗന്ദര്യമുള്ള സ്ത്രീയാണെന്നിരിക്കട്ടെ, ഒരു കുരു ഉണ്ടെങ്കിൽ അതിനകത്തൊരു വേമുണ്ട്. ആ വേം വെളിയിലിറങ്ങി ഇരുന്നിട്ടാണ് അതിൻ്റെ പരിപാടി രാത്രി നടന്നത്, നമ്മുടെ മുഖത്തിരുന്നിട്ടാണ് അതിന് ഗോസിൻ. അപ്പോൾ നമ്മൾ അറിയുന്നില്ല. സോ ഇതെല്ലാം കൂടെ കൂടിയതാണ് മനുഷ്യൻ. അതേസമയം യൂറോപ്യൻ ജേർണൽ ഓഫ് പിന്നെ കാർഡിയോളജിയിൽ ഒരു പബ്ലിക്കേഷൻ വന്നു 2018. The best vaccine to prevent atherosclerotic heart disease is small worms. നമ്മുടെ കൃമിയില്ലേ, ചെറിയ കൃമി, ഓക്സിയൂറിസ്, അതിന് അസൗകര്യമായിട്ട് വരും. വലുതായിട്ട് ചൊറിയാറിന് കുട്ടികളുടെ നഖത്തിനിടയിരുന്ന അത് വിഴുങ്ങുക, പിന്നെയും വരിക. സോ ഒരു വീട്ടിൽ വന്ന് എല്ലാവർക്കും അടുക്കള ജോലി ചെയ്യുന്നവർക്കുണ്ടാവും, അതിങ്ങനെ പകരും ഇങ്ങനെ. പക്ഷേ ദാറ്റ് ഈസ് ഹെൽപ്പിങ് അസ്. അവരൊരിക്കലും ഒരു കാർഡിയക് ബെഞ്ചിൽ കിടക്കാറില്ല, ഒരു കാർഡിയക് കാത്തിലാവിൽ പോയിട്ട് കിടക്കേണ്ട ആവശ്യം വരില്ല. അപ്പോൾ ദേണ്ടോ അക്യൂട്ട് കൊറോണറി സിൻഡ്രോം വരില്ല. അപ്പോൾ വേറെ ഇൻഫ്ലമേഷൻ ഇല്ല. ആ വേംസ് പ്രൊഡ്യൂസിങ് TH2 റെസ്പോൺസ് എന്ന് പറയും. വേംസ് TH2 റെസ്പോൺസ്, മറ്റേ TH1 റെസ്പോൺസ് വരുമ്പോഴാണ്, ഒരു തൈമിക് 1 സെൽസ് റെസ്പോൺസ് വരുമ്പോഴാണ് ഇൻഫ്ലമേഷൻ വരുന്നത്. അപ്പോൾ ഇൻഫ്ലമേഷൻ വരെ നമ്മൾ അറിഞ്ഞത് തന്നെ 2000 കഴിഞ്ഞിട്ടാണ്. അപ്പോൾ ഇത് നമ്മൾ റിട്ടയർ ചെയ്ത് കഴിഞ്ഞിട്ട് 5 വർഷം കഴിഞ്ഞു. 95 ഞാൻ റിട്ടയർ ചെയ്തു. സോ ഐ സ്റ്റഡീഡ് ഇൻ MBBS in 1957. അപ്പോൾ 57 ബാച്ച്, ഫസ്റ്റ് കേരള ബാച്ച് ഇൻ ട്രിവാൻഡ്രം. അപ്പോൾ അതിൽ നിന്ന് നമ്മൾ ഒരു 63 ആയപ്പോൾ ഈ കോട്ട സർട്ടിഫിക്കറ്റിന് MBBS 63 ജാനുവരി. അപ്പോൾ നമ്മൾ ഒരു പിന്നെ ചൈനീസ് വാറായിരുന്നു, ചൈനീസ് അഗ്രഷൻ ഓഫ് ഇന്ത്യ. അപ്പോൾ നമ്മളെല്ലാം ഉടനെ തന്നെ സർവീസ് ജോയിൻ ചെയ്യണം കമ്പൽസറി ആയിട്ട് പറഞ്ഞു. വി വെൻ്റ് ഇൻ ഡിസ്ട്രിക്ട് ഹോസ്പിറ്റലിൽ തന്നെ. അപ്പോൾ ഞാൻ കൊല്ലത്ത് പോയിട്ടാണ് ജോയിൻ ചെയ്തത്. ഒരു ഇൻസിഡൻ്റ്, നമ്മൾ കൊല്ലത്ത് ജനിച്ച ആളാണ്, എൻ്റെ ബർത്ത് പ്ലേസ് കൊയിലോടാണ്. മദർ പറഞ്ഞു, നമ്മൾ ജോയിൻ ചെയ്തപ്പോൾ ആ ബർത്ത് പ്ലേസ് എന്നൊരു ഹോസ്പിറ്റലായിരുന്നു, അത് പൊളിച്ച് കളഞ്ഞെന്ന് പറഞ്ഞു. അപ്പോൾ ഞാൻ ചിത്തിര എന്ന് പറയും, ചിത്തിര. അപ്പം നമ്മുടെ ഒരു ഹിന്ദു കസ്റ്റംസിലാണ് നമ്മുടെ അവിടെ, മുസ്ലിംസ് എല്ലാം ഇവിടെ. ഇപ്പം നോർത്ത് പോലല്ല, അപ്പോൾ അവരങ്ങനെയൊക്കെ ഫോളോ ചെയ്യും. അപ്പോൾ ചിത്തിര തിരുനാൾ മഹാരാജ വന്നപ്പോൾ രാജകുടുംബം തീർന്നു എന്ന് പറഞ്ഞ പോലെ നമ്മുടെ വീട്ടിലാണ്. പക്ഷേ നമ്മുടെ വീട്ടിൽ 3 ചിത്തിര വന്നു. അതുകൊണ്ട് നമ്മൾ ന്യൂട്രലൈസ് ചെയ്തു പോയെന്നാണ് ഇപ്പോൾ പറയുന്നത്. എന്തായാലും അങ്ങനെ പോകുന്നു കഥ. അപ്പോൾ അത് വന്നിട്ട് then I studied in various places, depending on my father's job. So mainly main studies were കൊയിലോണാണ് ബേസ്റ്റ് ഒരുപാട് സ്റ്റഡി. പക്ഷേ കുറച്ച് വാരം ഒരു സ്പ്രിൻറ്റ് വാസ് ഇൻ നാഗർകോവിൽ. അങ്ങനെയാണ് SLB സ്കൂൾ പഠിച്ചത്. നാഗർകോവിൽ, കന്യാകുമാരി വാസ് പാർട്ട് ഓഫ് തിരുവനന്തപുരം, കൊച്ചി. മെഡിക്കൽ കോളേജ് came in ട്രിവാൻഡ്രം, കൊച്ചിൻ. തിരുവനന്തപുരം, കൊച്ചി, തിരുക്കൊച്ചി. It was not Kerala. Kerala started only 1956 November. അപ്പോൾ 57 ബാച്ച് ആയതുകൊണ്ട് നമ്മൾ കേരളയിൽ ആണ് ചേർന്നത്. But I would have got a 56 batch and I was eligible because I was intermediate pass ചെയ്തു വന്നു. പക്ഷേ എൻ്റെ ഏജ് ഒരു 2 weeks ഏജ് കമ്മിയായിരുന്നു. I was not 17. So they did not take me. അങ്ങനെ I went to BSc. I studied 1 year BSc chemistry, physics and subject അത് പഠിച്ചു. 57 again applied and I got it. Even my father said, you complete that BSc later on. He said, after MBBS come and do the BSc. But I didn't have any opportunity. So അങ്ങനെയാണ് ഈ 57 വന്നത്.
ഹെമറ്റോളജിസ്റ്റ് ആയിട്ടും സാറിന് മൈക്രോബയോം വിഷയത്തിൽ ഇൻട്രസ്റ്റ്
വരാൻ കാര്യം നമ്മുടെ എൻ്റെ ഒരു സിസ്റ്ററിലാണ്. അപ്പോൾ ഷീ വാസ് എ പത്തോളജിസ്റ്റ് who was studied in Calicut and then had MD in Trivandrum. Married to my 2 people younger than me. He was a dental doctor. 4 kids and all. She developed an acute problem with vomiting and iron deficiency anemia in 2007 when she came for the marriage of my youngest son here in Calicut. So immediately my cousin nephew was a gastroenterologist, so he took her to our Gogol consultant here in the colonoscopy and found that obstructive lesion in the ascending colon. Next week, Sadanandan operated at gastrosurgeon here, MIMS. Operated, there was some shortening of the mesentery. Even though the fluorouracil and other treatments were given, 3 years later she had actually metastasis. And she had a metastasis detection was first on the dorsum of the left hand, which is a nodule, which was FNAC done, showed malignant cells. So I had scans on the brain and the CT of the chest and abdomen. So they found there was a ball in the third ventricle, which is just a ball, moving. And that produced intermittent unconsciousness. That is the problem which made her operate that. Well, there was no chance of a gamma knife treatment. We tried that. But so the ball was just like a table tennis ball, exactly like white table tennis ball. It was solid thing, and that tissue was colon. So even though initially they said in England, when we discussed about this case, because I was doing a locum consultant job in Wales at that time, they said it is very unusual to have colon cancer like metastasis like this, very unusual. So they were searching for breast cancer and other places, ovarian and other things, which was not there. Ultimately, this tissue showed colon cancer. So that was proved as colon cancer. At that time, she had lung and liver was involved, So she had extensive metastasis. They could not do anything. They gave Avastin, a course, and ultimately she died on the 1st January 2011 in Kim's Hospital, Toronto. So we all came from England. I was in England at that time, we came. And their sister, who is a dermatologist here in Medical College, now she's retired, she asked me whether this lady got infected with the specimen cutting. Well, she was processing colon cancer specimens, in the pathology. They process the samples, with a mask and a goggle and a gown and some gloves. So that question actually, I said, I don't know. I said, I don't know about colon cancer, but I have heard of Epstein-Barr virus producing some lymphoma, lymphoproliferative conditions, maybe related to Hodgkin's disease in children, and some chicken leukemia virus producing chicken leukemia. Humans, we don't know yet, like that, I said. So that was something which was in my mind. Fortunately, we saw in October 2011, the Cell and Microbe Journal, they found a bacterium gene on colon cancer. It was Fusobacterium nucleatum, So why, you may ask him how I saw, was I subscribed to Journal Watch first time, 86, in Calicut here. And I was a subscriber of New England Journal even before as a student. So, and I asked Betty Clancy, she was the relations manager in EJM. She allowed me free access to all Journal Watches online. But Journal Watch came online only in 93. I subscribed from 86. So that is also history. So the initial newsletter, 15-20 page newsletter with the holes on it for filing. Till here, we can use in a museum. Well, that is original Journal Watch, only for medicine. Then it came cardiology, then neurology, then immunology, then hematology, like that. So many Journal Watch came. Now there are so many. So everything became online 93. So they gave me free access to all journals. So I could see that was my job, looking at Journal Watch and seeing all this. So that in clinical meetings here, my son also joined here. He came from Trivandrum. On 88, he joined a postgraduate here. Trivandrum, he joined in 83 January when I came from England. I didn't get a job in Trivandrum. There was a vacancy. Somehow I was not posted there. And ultimately, I came here because of the influence of our Janab Muhammad Koya Sahib. He was deputy CM. It was his influence. There was no vacancy in Calicut. It was only Professor Krishnadas vacancy, the director. He didn't come. He didn't want to come. And M.G. Sadhavan was holding the unit, like head of the department. So that was downgraded, and I was posted in Calicut. And that was the 6th time I was posted in Calicut. The first time I avoided somehow coming. But I didn't want to come. I wanted to stay in Toronto. Every time you have easy access to secretariat for something, some favor, the AG's office from some increment or something. So like that, always the beach museum and this was, we are going around and around there. We did not know what was happening in Calicut also. And that is how it came.
വേറെ ഏതെങ്കിലും ബാക്ടീരിയ ഈ ക്യാൻസർ ഉണ്ടാക്കുന്നുണ്ടോ?
Yeah, then now we know there are 3 bacteria connected to cancer colon. One is Fusobacterium nucleatum, other is PKS E. coli, it is called. So polyketase, producing E. coli, which is a genotoxin, like a genotoxin. They call polybactin, that substance. It is acting as genotoxin. The other is enterotoxin producing bacteria fragilis. There are 3 bacteria. So they are studying on this now, how it is actually related to this, and how it is related to family history. I can tell you one thing. My neighbor, my neighbor had colon cancer in 2006. His youngest sister, about 31 years old, was seen by me in 1991, 19, that time. She came with her son with a diplopia, I mean, not a diplopia, skin and eosinophilia. So the Dr. Salam, neurologist, offered for hematological opinion. So son came here, so I did our work, and then while returning, she said, I have some problem like a little mucus in stools, I said, okay, but you will have to check your stools. So I wrote a stool examination and flagell tablet I gave. I take that and see, and next week you should come. You're coming from Mahi. Mahi. Then she came next week and said, it is better, but still I have. So I had to examine her and found there was a suspicion, something, at the fingertip, like higher up. So I sent to Baby Memorial and Dr. Professor Karthikeyan, with a retired professor here. He was there. He did sigmoidoscope that time. There is no colonoscope and all at that time, Sigmoidoscope. The here colonoscopy was not that advanced. Yeah, it was sigmoidoscope and biopsy. And that actually was a malignancy. She went to Tata Memorial. She had an anterior resection, and without any colostomy, without any treatment, she came back. She's still living, she's still living. And she had some pains in between, and they had so many workups for cancer, and nothing was found. And then when I went to Saudi after retirement, so while in Saudi, this lady's elder sister had abdominal trouble. So she went and asked this lady, what was your problem? And so she described that. So she straight away came to MIMS hospital. Was diagnosed with colon cancer, operated, went back without any treatment, and she is also okay. And then I went from Saudi, after 10 years I went to England again. So in 2006, this man's colonoscopy, that finding, a photograph was sent to me by his son. I said, get in touch with the medical college and get whatever is needed. Then his eldest brother, Muhammad, sent his piles treatment protocol to him, younger brother. That he didn't go to that, he went to hospital, he got the treatment and resection. That is it. So generally last one of the first, Muhammad came in with inoperable cancer. His files was actually cancer to begin with. So he started first in the family. Started first, and by the time all his intestines were all adherent, and the lung was involved. So at the time, Dr. Nasser Yusuf saw lung and then found out this came. I said, he had the first disease. He didn't actually look at it. They were taking his piles and going on. So there's a family history. So I asked our neighbor about what is happening in Mahi. He said, there are so many people with malignancy colon there. They go to different places. Mangalore, they go to sometimes the Malabar Cancer Institute there, sometimes to Kochi, sometimes to Trivandrum, like that. So that is why. And different, not only Muslims, different other categories of people also. So then I said, there may be something in the soil. When I said about these three bacteria now, well, somebody will have to go and study the soil there and see what is happening to the surroundings, what sort of water they are drinking, what is the food habits. And so these cancers are not all hereditary or anything. So if you have a gene, doesn't mean that you will have a phenotype. So genotype doesn't match with phenotype. If you have a breast cancer gene, don't take out your breast, because it doesn't mean that you will develop disease. That is this thing is grasped only by the African Indians, in America. They never do any breast replacement, and all the European ladies, they chop off your breast and chop off your uterus and ovaries to prevent cancer and put some rubber on the chest, I don't know what for, and then their life is spoiled. Others go to marry, they have children, and they die old age, So genotype and phenotype are different. So why? Because you are 57% bacteria. Your body is only 43% from your mother. So the genotype comes there only. So you have only 20,000 genes. So genes were discovered in 2000 by 2000. So after 2000, they said gene has no value. Discovery of gene doesn't make any difference. Only for a hearing defect, gene cutting and some a little bit gene for the thalassemia. That is all developed, recently. Otherwise, no use of genes. So, because your bacteria has 150 times more gene power. So, you have 20,000 genes and bacteria have 150,000, 150 times more. So, these bacteria can change even your thought processes. So, from your psychology to your cancer, from your heart attack to your stroke and degeneration of the brain to aneurysms of the brain, all these are connected to bacteria in the gut. That we knew only very recently, like recently means the last 15, 20 years, research. The research started only in 2007 and the publication was in 2012. That is why my sister-in-law's death was in 2011. So
Then you
discovery of the
started
bacteria was
following,
2011 October. And publication of this human microbiome project 2012 August. And the European study in science and Chinese study in science. Only gut microbes, only gut there. Just feces, And the feces contains only 2% of viruses, 98% still to be studied. And this 2% is not going to kill you. It is producing favor to you. It is producing digestive enzymes. It is digesting the cellulose. It is producing growth factors. It is producing hormones like resistin, adiponectin, like that, leptin, these fat hormones, or irosin, and all those endorphins. So many things are produced by these viruses. They are not idly sitting there. Another thing is, only a virus can swallow another bacterium or bacteriophage. Only one bacterium can kill another bacterium, like antibiotic and Clostridium type 14 alpha killing VRE. So that is why the fecal transplant given from the donor in stem cell transplantation to the recipient at 5th week of neutrophil engraftment, if his diversity in the gut microbe is reduced, you give the donor feces actually to the recipient. They become normal, without malignancy, without any graft-versus disease, without any septicemia, VRE septicemia. So that is 1,000 and odd patients, in 4 centers to match the geography. 2 centers in America, one in Japan, and one in Germany. So that paper was groundbreaking in 2020. February, while the COVID was only active here. And then came the Chinese study in renal transplantation. So you are giving a relative kidney to the lady, and the lady is getting rejecting the kidney. What to do? Now what they have done? You are putting the mother to girl, mother to daughter kidney. Mother's gut microbiome transferred to the recipient. Her kidney will get on. And that study was done in China. Actually, China is higher up in these studies. And all these studies for the vaginal microbiome transfer for the babies during cesarean section. The major study was published from China in 2023, June. Where the first study was in America. It was 30 studies in 2012, natural medicine. Here now it is called Frontiers in Microbiology. That is, this was published. So that is a triple blind study. That is, you don't know which is vaginal liquid or which is saline, and who is giving that, to whom it is given. Everything is blocked. They found the results. It produces developmental improvement if the vaginal microbe transferred the baby in a cesarean section. So that is the importance of this. So don't think that bacteria are infecting you, because infection is a complex process. They come and the receptors on our cells called toll-like receptors on the surface like aerial, NOD receptors in cytoplasm, and the collagen receptors. So they are watching what materials are coming. So they think it is something to come and attacking, something coming, attacking. As a pattern, pathogen associated molecular pattern. That is why they are attacking. And then get inflammation starts. And this inflammation produces a disease, whatever disease it is. So it can be heart attack, it can be stroke, it can be a cancer, it can be anything. It can be an autoimmune disease, like HLE or rheumatoid arthritis or myasthenia gravis and antibody production. And then you call it IgG4 disease if you don't know anything. call it this way, you are classifying. So there is no need to put the compartmentalization of diseases now. The compartmentalization is leaving off, and the disease gets a hold in the intestine. So if you keep your intestine good, then you are perfectly healthy. That is what you should remember.
ഈ മൈക്രോബയോം ഒരു സാധാരണക്കാരന് ഇപ്പോൾ നല്ലൊരു മൈക്രോബയോം കിട്ടണമെങ്കിൽ അവർ എന്തൊക്കെ ചെയ്യണം അല്ലെങ്കിൽ എന്തൊക്കെ ചെയ്യരുത്?
Yeah, microbiome, see, first of all, it is your luck to get a good mother. Because your mother's microbiome is going to your mouth when you are delivered normally. The normal delivery, the vaginal microbes are swallowed by the baby, and that is going from mouth to anus and fitting up in 3 years' time. So it will take 3 years for the child to develop full immunity and become a proper, sturdy individual to resist anything in the world. So don't think that this sort of pouring polio virus into the mouth is good. No, worse. If you learn this, you will find that we are doing foolishness. So that is why America stopped that 40 years back, and they gave that to all these countries. And I don't know why they gave this. I wonder. Now they changed the name of the polio in Los Angeles and all. They call it AFM, acute flaccid myelitis. They don't call any more polio. They're all polio. And possibly they are from these viruses mutated in the street. And so the vaccine viruses were producing the disease. That was in 2007. They were about to say that we have eradicated polio. Nothing happened. In 2007, this came polio from the vaccine virus mutated in Vietnam. So that is how it goes. So, and when your cells are powered by mitochondria, the mitochondria are given from your mother. And the mitochondrial DNA can leak, like a leak-proof battery can leak sometimes. So that is what is called some of the particles of the nucleus, that comes and that breaks the mitochondrial membrane, and the mitochondrial DNA leaks. And this DNA looks like a bacterial product to the receptors. So bacteria, they attack, they produce inflammation. That is another cause of inflammation. Why you get spontaneous inflammation? There need not be any infective materials. So don't think that every bacteria is infecting you, because that infection is a very complex process. It's an adjustment between the attacking organism and our body. There are so many the things involved. So previously they thought the kidney, and you are seeing the kidney clear cells, and in between you find lymphocytes. That is our microscopic picture. But why the lymphocytes, we did not know. Now it is called tumor infiltrating lymphocytes, and they are the ones going to clear the renal cancer. So then if you take tumor infiltrating lymphocytes and process it and give like CAR T cells, the kidney tumor metastasis can be treated. That is one of the new avenues. Like what happened, the CAR T cells, chimeric antigen receptor antigen cells, and CAR T cells. Not well in myeloma, but still they are trying. I don't know what is the result, but I am not involved in active treatment of myeloma. I think my son is involved more. So I ask patients whether they are on microwave exposure, microwave heating. I am dead against microwaves, dead against microwave. That is why but I think my children don't like that. Well, especially some of them, they get angry when I say microwave. Okay, I'm not saying too much about that, but microwave, anything which alters your food, the way your food is cooked is very important. The way, so the pan, what you use, all these non-stick things are not good at all, and our old pans are better, and even our chatti, അതൊക്കെ നല്ലത്. അപ്പം അങ്ങനെ കുക്ക് ചെയ്യുന്നതാണ് യുവർ ഗുഡ് ഹോം കുക്കിംഗ്. And our at least up to gas, okay, electricity, but not an induction cooker, not on microwave. In the plane, I asked the soup was heated in the microwave. That is plain. I cannot do anything else there. But
പ്രീബയോട്ടിക് പ്രോബയോട്ടിക് ഒക്കെ മൈക്രോബയോ ബന്ധപ്പെട്ടാണല്ലോ.
Yeah, prebiotic. So probiotic is a microbe. Prebiotic is a diet which improves the microbe. That's prebiotic. And the postbiotic is the interaction between that particular material and the microbe together. They are the postbiotics. So the postbiotic we are dependent on mainly 3 things. One is propionate, other is butyrate, other is acetate. These are the things. So propionic acid, butyric acid, and acetic acid. Then the next one is a gas. Gas is called TMA, trimethylamine. And gas is given an oxygen from the liver, that is a flavin monoxidase, gives an oxygen. So it becomes TMAO, trimethylamine oxide. And that is the one producing platelet adhesion and the thrombogenicity of the blood vessel and heart attack. It is TMAO that produces heart attack, not LDL. So Circulation Journal, which is a famous heart journal from American Heart Association, has changed their last paragraph. Statin reduces TMAO. And not statin reduces LDL anymore. No, LDL they give. So LDL is poor LDL, everybody is after that, and they think that LDL is saving. No, LDL is protecting you. LDL is protecting you from bacterial infections. But they take a molecule in that bacteria for them to colonize, they won't allow. And it's giving you strength, when you are fighting or when you are speaking or when you are arguing, your adrenal hormones and cortisol and everything, LDL is supplying the energy, LDL. So don't blame LDL and treat LDL, and don't say that bad cholesterol, good cholesterol. Every cholesterol is good. You need 100% of your brain is cholesterol. Your whole body cholesterol is from the sunlight. You get vitamin D, and vitamin D is not a vitamin; is a hormone. And only two hormones are related to external environment. One is thyroid. The thyroid iodine produces all the havoc now. Every little girl is having thyroid problem, but everybody is given iodized salt. So iodized salt should not be uniform. It should be stopped. It should be only for those living higher up in the mountains. And let them eat it. Don't give that people who are living near the sea. Let them eat the sea salt. And that is, they are eating fish, meat, and water iodine. So excess iodine can produce both hyper and hypothyroidism. And the main pathology is that. That is why all these businesses came. See, now the thyroid tablet and thyroid care laboratories and all. I think I have some reservations in these things. So I just say that.
മൈക്രോബയോം ട്രീറ്റ്മെന്റിൽ എവിടെയാണ് ഉപയോഗിക്കുന്നത്?
Yeah, treatment, we are actually, your whole body is covered by microbes. So the study in NIH was 241 men and women, and the women, there were 18 sites studied, and women 15 sites. Otherwise, 9 sites are in the mouth, 9. And the 3 extra sites in female is the vagina, front, inside, and fornix. So the others are, areas, like eyes, ears and nose and skin folds and like that. So this is the difference in the study. And they analyze this. It's a very expensive study because each of the studies costs about $4,000 and all, like, or metagenomics and cell equipments you need. So the study of the gut in India was proposed to be in 2019 and 20. Unfortunately, the COVID completely spoiled this. So the Indian gut is not studied. Only the Indians in America studied, in NIH, a group of Indians and a group of other Asians studied. Then, so these transfers can be affected from your gut in the form of fecal microbial transfer, or duodenal microbial transfer, like right shift, or vaginal microbial transfer. That is another thing. See, that is what for the fetus we are giving away the child, cesarean babies, we are giving vaginal transfer. So, but it can be used and modulated in other ways. We can do. So I can say something, that is, your whole body is covered by microbes. That is like a commando. And that is the microbes preventing you from melanoma or cancer of the skin or the breast cancer for the ladies. So putting antiseptics, sprays and all, the axilla to prevent the sweating and things is a dangerous thing. Don't do that. So if you want a perfume, you apply over the clothes and not on the body. So body you should be careful. Because the whole skin is covered by microbes. And that microbes you got from your mother and from the surroundings later on. So from your partner, from your children, from your home surroundings. Even when the closet is, you are flushing, all the microbes coming in. So the situation depends on the environment. So the spoiling the environment in COVID was an utter mistake. I didn't write that at that time. And then one of the, our Mayura is the So doctor told me, write something about COVID. I said, no, I won't write anything. So I wrote on the Manishanum, Cheruvadalum, Sushmanakalam. That I wrote something, and that became very popular that time, 2022. So many people wrote on new ways of treatment. Nudala Chikitsa Reedigal, the transfer of microbes. So we treated first time a naive patient with Crohn's disease with the wife's fecal microbial transfer to the husband, and he is very well now 9 years. 9 years. 2015 December was the incident. 2015 November was and I saw the couple here. Because his father is here in Calicut, his brother is married to my tax lady. That is the connection, And I only described all these things. And I only said about my talk on 2014 February in Calicut about human microbiome and health and disease, where I covered almost all the diseases. I wanted to tell only my sister-in-law's case, but it covered all the diseases, from autism to your various cancers and heart attack, stroke, and everything. So it was so interesting to Bhargavan. Bhargavan asked me to repeat that in baby memorial. Next Wednesday, I gave a baby memorial, same thing, talk. So many doctors and nurses came to me for bumetanide to give their children with autism, bumetanide. Bumetanide I was taking for my diuresis. It was not available here in England. So I was taking so many tablets for blood pressure. All started in 2009. It was 11 years after my bypass in 1998 when I thought I will pop off that time. Because I had a proximal lady block with a diagonal involvement. So fortunately I was not given a stent, but stent was only metal stent that time, and stent would have blocked the diagonal, big diagonal. So I am one of the earliest radial graft person, radial graft, the diagonal to aorta, and the lima to LAD. So perfectly, they were working 11 years later on an angiogram in 2009. But unfortunately, a cardiologist there started me on losartan as a blood pressure medicine, and then went on to gatisartan, because I don't like telmisartan, I don't like olmesartan at all. It produces very severe intestinal problems, Colic syndrome, and a granuloma of the intestine. So all these produce my eczema, the leg eczema. And the eczema I got from the journal watch. CEEA, chronic eczematous eruption of the aged, was proposed as a side effect of calcium channel blocker in 2012-13. And I said my thing is eczema, so I stopped amlodipine. But unfortunately that eczematous flap got infected in 2016. And that is I got a big leg like that. I thought it is compartmental syndrome. And that and this dressing with Maxelfed next day, one day waiting and next day putting there, the whole leg was black. I thought I lost my leg gangrene. And there it is Maxelf, heat of the Maxelf. You put salt, they put in a bucket with salt. And that actually got the bacteria, I think, which is called Streptococcus, agrexia, no, it is called dyslexia, is a group B Streptococcus. It doesn't go at all. It was remaining there, even though it was pan-sensitive cocktail, penicillin sensitive. You have tons of penicillin injection, 6 weeks continuous insulin, penicillin, linesulin, and oral penicillin, prophylaxis, doxycycline, recurrent infections. And last one I got fed up. I was unconscious. In 2024, January 20, I became unconscious. I was taken to Ikra hospital. Our lady here said later on. I just woke up from there. I thought I am dreaming. The nurses were pulling me up and down like that. They're turning me. I thought I was dreaming. So I just slept again. But still, that process went on. Then I saw Dr. Pradosh appearing. Then I thought, oh, it is not Sopinam. It's something in അപ്പോൾ എന്നാൽ നമ്മുടെ മകൻ വരുന്നു, അവൻ ഇംഗ്ലണ്ടിലായിരുന്നു. He said, oh, NIV വെച്ച് നന്നായി എന്ന് പറഞ്ഞു. I cannot talk about this. NIV was here. The bypass and all. Wow, that is why you became better than that. Okay. And the girl who looked after me and Raghuram, there in Accra, I could not thank her, but I didn't know that she helped me that night. And Pradosh told me. I told her to see me sometime. So far I have not seen that girl, but she was with me all night and I was shocked, they gave me norepinephrine drip, and then large of the bile duct on. My muscles were all rigid and difficult, so difficult to walk, and so it was terrible. So I just had a diarrhea, means emotion was not in control. And they cleaned me up all the things. The nurses there took a lot of work, So fortunately I survived, and I thought I will do something, this time. I don't want to become again another, somewhere lying down, unconscious somewhere on the road or the streets. Then I told I am going to do something which out of my mind and whatever I am thinking now. So I thought, when I said the microbiome change in a little baby, 1 year and 4 months old lady, the mother's microbiome saved her from resistant Klebsiella, which are about to kill her in an ICU. And everybody was saying nothing to do. I only proposed, because that is a cesarean baby. I said, cesarean baby could not have all the microbes for the bone marrow working. The trophic influence of the bacterium is there for bone marrow. That paper came in 2016 in the Blood Journal. So that is why when you take a lot of antibiotics, when you take it, you get a low blood hemoglobin. Because marrow doesn't start working. Even like in a plastic anemia, it may look like. So you can replenish the microbes, and your bone marrow will start working. So that principle, I said, and so why don't only one organism can be killed by only another organism. So I told that mother, the mother was prepared with the vaginal soap culture for any abnormal organism only. So we touched only two things, ESBL E. coli and group B streptococcus, that is all. That is not present. So she is fit to be used as a donor. So that is why she said it was the last chance. She did that. The baby woke up, and in 24 hours, and baby was sitting up. So the picture, next picture, the baby sitting up. And we had all the audio after that. And then I said, better run away from the ICU so that you can get another infection. And then baby is now 3 years old. They sent me a picture of the baby, and she's in Kutyadi. I was thinking of that mother in my mind, because I don't have my wife or somebody here, to help me. Now the children are away, and they are on their own. So there was a donor who was actually very kind. And then the Ikra hospital actually managed to treat me by transfer of microbes from the leg. So simple, that is my own method. I was trying. I said I can even take it orally, like to the right tube into my duodenum. Because in the stomach, it may get damaged in the stomach, So just to go to duodenum. Then anyway, the external thing worked dramatically. And all the blebs and all these lymphatic problems and all disappeared in 6 days. So March 5th started. March 11th, we have a video, to see the improvement. March also the Ramadan starting. So I didn't want to bother the donor and Ramadan, so we stopped there. And all my friends came, and the surgeons came. They said they were wanting. They were wonderful results, they say. And they said, do it another 1 more week at least. For my classmates even said. So anyway, we did another 7 days later on, and I went to England, and all that time I went to England, and was I had to just go there, because I renewed my previous visa, with difficulty after 4 years. Was only 2 years I can stay outside the resident visa. But I didn't want to change my passport, so we didn't change to UK passport. We are Indian passport only. And my wife didn't allow me to buy any property there, and no passport change. So we are just here. So we connected in England, and I was more reluctant to go because of the vaccine. Well, I don't want to take that vaccine. I advise them, from my knowledge, whatever I gathered, it is right or wrong. Human immunity, we know only very little, very little. Even all these, whatever I said, there are points which we don't know yet. So the researchers have to go there, and not in chemicals, research on chemicals, one chemical to another, one chemical to another for diseases. So one example is diabetes. I said diabetes, that is one. And the blood pressure, that same blood pressure from related to intestine. That is a gut prediction of diabetes, gut prediction of blood pressure, where the bacteria in the intestine, which is lactobacillus, stops the Th1, Th17, and Th22 cells, the lamina propria, to produce inflammatory cytokines. That is how blood pressure is controlled. The other is magnesium in the diet, which relaxes the blood vessels. The calcium contracts in that. So the relaxation is effective in a dietary deficiency of magnesium. So if you take nuts and other things in the diet, and if your blood pressure will become normal. It's just like pushing the hose and pressing the hose, blood pressure goes up. Relaxing, the pressure comes down. So people are unnecessarily taking antihypertensive drugs, according to my view. That is my own view, because I discarded all those things, And my doctor was in a cardiologist here, who prescribed me from NIMS hospital. That is my daughter-in-law's hospital and multi-specialty in Trivandrum. I was surprised when I said I don't take any tablets now, but he was checking me for my blood pressure and other things for a possible eye operation, which eye operation they didn't do. They said there is enough cataract to produce that. But I stopped the statin in 2013 out of fear, because there's another gentleman, doctor, 48-year-old doctor came with loss of memory, and that was found to be a statin. So I got upset and afraid. So I stopped and I asked my son to stop. Now I don't actually fancy statins as a treatment. So I say, and the papers on statin as a paradox came in 2021, JAMA. So statin paradox. So when you give statin, you get serial calcifications increase in the plaques. The plaque calcification happens, not a plaque clearance or plaque prevention. So people don't know that. At the same time, if you eat a salad, good vegetable salad, vegetable soup, broccoli soup or Miringa soup or something like that, നിങ്ങളുടെ whole cholesterol metabolism get corrected. So with a science, intestinal cholesterol export, dice, is 20 times more than the liver export. So for the liver export, you are taking the statin. Understand? Even the PCSK9 inhibitor, the antibodies, like glycerin and the other very expensive, 9 lakhs, and the other is 5 lakhs, the Raypata. All these are producing on the protein, which actually destroys the receptors, LDL receptors. So improve the LDL receptors. So that is only 1/5 of what is happening in the intestine. So intestine, the cholesterol is coming and jumping into the intestine. It is passed in foam cells in the motion. So the cholesterol is 100% needed for you. 100% brain cholesterol. Without cholesterol, no memory, no synapses. Your vision, your lens, lanosterol, your coenzyme Q10, and all these things. And if the cholesterol metabolism stops somewhere in between, you get serious diseases. Very morphologically, they become very abnormal. So the beauty means cholesterol. So if you want, are you married? No. So when you look at a girl, do the cholesterol first, and see select one from 300 to 400. So like Aishwarya Roy or somewhere, 360, 340, very nice girl. So you can see the face and see the difference. So a beautiful lady and a handsome man will have cholesterol of this level. Don't make them worried. Don't make them spoil their health. That is my request. Anyway, I don't know. So people will agree with me, but that is my idea.
സർ ഈ BSL-3 ബിസ്ലാക്ക് പോലത്തെ സപ്ലിമെന്റ്സ് ഒക്കെ അല്ലേ, അതൊക്കെ റൂട്ടീൻ ആയിട്ട് ആൾക്കാർ
Supplements, actually, I believe in some of these supplements like turmeric and pepper and ginger, and the cinnamon and clove. They have the same sort of nutraceuticals. And these nutraceuticals have anti-inflammatory effect. So the research came from MD Anderson, which I believe that, Bharat Agarwal, in 2003 published a paper in Blood Journal, the diphenol methane, which is curcumin, in myeloma cells. In that culture, they produce some effects and describe some actions. NFKV blocking, rangangligan blocking, iron chelation, they sort of working, brain iron chelation. So they are all published in blood journals and different. 2009 was the iron chelation. So now the degenerated diseases of the brain, like brain tracts ataxia and other dementias, are due to iron deposition diseases. So turmeric may chelate the iron and make them better, or make them or prevent the iron deposition disease. So that way it is good. No, I take it was from 2003 onwards. I told my brother, with a neurologist, and my sister gynecologist. They were using it left and right, And I have stopped using dexamethasone for COVID. I have treated so many COVID patients on videos, not only in India, in all over the country, I think, all over the world, even in somebody in Denmark, so the one in somewhere in Italy, like that. They're all our people in different places. In America, Seattle, and Saudi Arabia, and Dubai, many. Dubai, so I said, don't take any of these things. But they were all vaccine recipients, some of them vaccine recipients.
സാർക്ക് എന്ത് ഉപദേശമാണ് മൊത്തം പൊതുജനത്തിന് കൊടുക്കാനുള്ളതിനെ പറ്റി പറയുകയാണെങ്കിൽ അവസാനമായിട്ട്?
I say, I send a prescription, the general prescription to those who like my opinion or can grasp that my opinion. I said, those who have taken the vaccine better take colchicine. That is my opinion, colchicine. The colchicine is an anti-inflammatory, best anti-inflammatory drug, which is used for familial periodic fever with amyloid collection in the kidney and pleural effusion, pericardial effusion, such things. And people die early. That and any good meal improves their produces a fever, and they get inflamed. Body gets inflamed. So it is a C5a blocking which is needed. So the colchicine acts as an anti-inflammatory. Previously we used it for acute gout only, small doses, few doses. Now we are giving it a long term. And I am an example. I had taken almost 2 years. I am taking not because of vaccine. I had a gout that inflamed gout, and that produces severe problems. In August 2023. From there I was taking colchicine. I continued that, and I asked the people to take. And other things I write is B2 vitamin, riboflavin. So riboflavin improves the mitochondrial DNA leak. So it improves the mitochondria, reorganizing and what is called overhauling the mitochondria. So mitochondrial leak will be prevented so that your inflammation is reduced. So you get better health. That is what I think. And another thing is, it is having the effect through mate cells, mucosa associated invariant T cells. They are from the gut, and that is the one preventing esophageal cancer. So for esophageal cancer prevention, I think riboflavin is the best drug, best vitamin. Okay. So it is very useful for the skin and other things. And migraine, I don't use anything else, high dose riboflavin only. So high dose riboflavin came to England only in 2019. There are 400 milligram tablets and capsules now. But previously, I started in 98, seeing the Lancet seminar. And the paper was in 1997, Cephalalgia, where the riboflavin tried and up to 400 milligram. And from that time, I am giving only riboflavin, nothing else for migraine. And my wife, I gave the sumatriptan when it came, like 10-15 pounds, one tablet, somebody brought from England. I gave one tablet, I thought she will get paralyzed, She had so much of problems, I never prescribed any triptan. Triptan I hate, I didn't prescribe anything. And the triptan war was going on, like sumatriptan, naratriptan, elatriptan, and now the frominosamab, CGRP inhibitor, at a cost of 28,000 pounds a year. One injection per month, reducing only 4 headaches, and you get 26 headaches. And that is the headache of the NHS, they stopped it. So the drug was stopped, that closed, the chapter is closed. And now everybody says riboflavin, and the only problem is patients are not coming to me now. I don't have much patients here. The patients, they treat themselves. Salim sir പറഞ്ഞു ഇത് കഴിച്ചാൽ മതി നിങ്ങളെ മൈഗ്രേൻ പോകും എന്ന് പറഞ്ഞിട്ട് they are all taking that. And സലീം സാർ പറഞ്ഞു 5 മുട്ട കഴിക്കണം, കൊളസ്ട്രോൾ പേടിക്കരുത് എന്ന് പറഞ്ഞു. അപ്പോൾ നല്ല മുട്ട എല്ലാവരും തിന്നും, അപ്പോൾ നമുക്ക് കിട്ടത്തില്ല, മുട്ട കിട്ടത്തില്ല. ഞാനും പറഞ്ഞു കുറച്ച് മുട്ടയൊക്കെ നമുക്കിവിടെ തരണം, എല്ലാം നിങ്ങൾ തിന്നരുത്, വീട്ടിൽ നിന്ന് മുട്ട കിട്ടത്തില്ല. ഇപ്പം ചൈനീസ് മുട്ട തിന്നാനും പറ്റില്ലെന്ന് പറഞ്ഞ് കത്തിച്ച് നോക്കണം, അത് എന്തോ പ്ലാസ്റ്റിക്കാണ്, അപ്പോൾ ഒന്നും കഴിക്കാനും പറ്റില്ല. അപ്പോൾ നമ്മുടെ ഫുഡ് ഹാബിറ്റ്സ് നന്നാക്കുക, നമ്മുടെ സറൗണ്ടിങ് നന്നാക്കുക, നമ്മുടെ ചുറ്റുപാടുള്ള ആളുകളെ ഒന്ന് ശ്രദ്ധിക്കുക, അവരും കൂടെ എല്ലാം കഴിക്കട്ടെ എന്ന് നമ്മൾ വിചാരിക്കുക, ഇതാണ് വേണ്ടത്. സോ യു കെയർ ദം, ഡോണ്ട് കെയർ യുവർ കൊളസ്ട്രോൾ and waste your money by going to the lab and checking that for 5,000 rupees, you know. Give to others, your neighbors, let them eat and want some cholesterol and at least some food in. That is the principle, you know. So don't be selfish to live, you know, in this world, you know. You cannot live on your own anyway. You will have to depend on somebody, you know. I am suffering now, you know, for that. You know. I don't have a partner, you know. That partner was too kind, that is the problem, you know. I suffer. So you think of others also, let them also live. So you get the happiness from helping somebody else, you know, who is in need of, you know, help. And don't keep you know, the health to your property or something like that. It should be everybody around. So I am actually in favor of that principle. I don't know what people will tell about my views, I don't know. But that is my view at this end of the life, you know. I don't think we will be here for long, you know. And I am prepared to leave, you know. And seeing all the artificial intelligence, and I don't know what is going to happen. And I even worry whether the human race will be erased from the world, you know, on this earth. So I don't know, we'll have to sit and see what happens.
ആരോഗ്യജാലകത്തിൻ്റെ ഈ രണ്ടാം അധ്യായം ഇവിടെ അവസാനിക്കുകയാണ്. വീഡിയോ ഇഷ്ടമായെങ്കിൽ ലൈക്ക് ചെയ്യുക, സുഹൃത്തുക്കളായി ഷെയർ ചെയ്യുക. ഇതുപോലുള്ള കൂടുതൽ വിഷയങ്ങൾ കേൾക്കുവാനായി, ഡോക്ടറിൽ നിന്നും കേൾക്കുവാനായി ഈ ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുക. നിങ്ങളുടെ വിലയേറിയ നിർദ്ദേശങ്ങളും അഭിപ്രായങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുക. മറ്റൊരു അധ്യായത്തിൽ മറ്റൊരു വിഷയവുമായി വീണ്ടും കാണും വരെ നന്ദി, നമസ്കാരം.